Hello everybody and welcome to this month's vlogcast. This month I'm really excited and delighted to have Professor Lesley Anderson, Chair in Health Data Science at the University of Aberdeen and Chief Investigator in the MOSAICC study. I know, having spoken to a lot of patients at forums, that MOSAICC has been close to everybody's hearts in the MPN community, and so many of you have raised a significant sum of money to enable this vital study to go ahead. Welcome Lesley, and thank you so much for agreeing to talk to us today on this month's vlogcast about MOSAICC. Tell me, how did it all begin, MOSAICC?
Thank you, and I am absolutely delighted to be here to be able to give you some details around the study. The study started as part of my research portfolio whenever I was working at the National Cancer Institute in the United States. And I was looking at different types of blood conditions and trying to identify the causes of those conditions and factors that might be linked to the development. And what I identified was that the MPNs seemed to have a completely different profile to the other blood conditions that we were investigating. So whenever I returned to the United Kingdom, I spoke to Mary Frances McMullin, who's a professor of haematology in Belfast, and to Dr. Andrew Duncombe in Southampton. And they were very interested also in identifying what might lead to the development of myeloproliferative neoplasms. And so that's where the study came from.
So initially it started in Belfast or in Southampton, or both?
So the pilot study ran in both Belfast and in Southampton. We recruited 106 patients with MPNs into that pilot study, and really we were looking to identify the best methods to roll this out to recruit patients from across the UK. Because obviously this is a condition that is not very common, and we need to get a large number of people taking part in order to be able to identify factors that might lead to the development of MPNs.
This is so exciting because as a patient, you know, to the thought of actually, how did I get it? Why did I get it? Can it be cured? Is always in everybody's minds. You know, and I think it's great. What came out of the pilot study? Where did the information go from the pilot study?
So the pilot study, as I said, recruited 106 patients, and we had 127 members of the public that also took part, because it's critical that we have patients with MPNs, but we also have people from the general public taking part so that we can make comparisons. We find that there were some associations, and an association is something that is linked or potentially linked to a condition. We can't say whether it causes the condition or not, but where it is potentially linked. Some of those factors included smoking with essential thrombocythemia, and also obesity or being overweight with the JAK2 positive patients, so patients with the Janus kinase mutation. We also identified some other factors, including some potential occupational exposures that really required a larger study to be able to look at. So the study identified that MPN patients were very keen to take part. Whenever they did take part, they took part in all elements of the study. And we were asking lots of things. So we asked them to give blood, to take toenail clippings, to provide saliva, and also to do blood spots, so to prick their finger and put it on a little card at home to see which of those methods they preferred. And pretty much all patients that took part did everything. But we did identify that the pricking the finger was not as preferable for patients, which is completely understandable. So the current study is taking a blood sample at the patient's clinic appointment, and they are providing saliva samples and toenail clippings, which is always an odd one.
And It is an odd one. And also, were the results of the study published to the wider community?
Yes.
Have access to the results?
Yes, so there are about 8 publications in total that we have put out from the pilot study and the work that Glenn James, who was funded by MPN Voice to do his PhD, undertook as part of his training. The results have also been presented at the American Society of Haematology annual meeting, and at the British Society and the European Haematology meetings as well, so that the results have been communicated with the wider clinical population. They've also had some links with information as well provided by yourselves at MPN Voice, so that patients could see what was identified and have access to those publications as well.
Great. So where are we now with MOSAICC? I know that in Ireland they've opened some sites, and we've got sites open here, which is exciting. So where are we now?
So we have 14 sites open as of last week, which is really exciting. Our target is 19, so we've got the majority of sites open within the UK. We are open across Northern Ireland in Grampian, NHS Grampian in Scotland. Glasgow is hoping to open soon. And we are also open in a number of hospitals throughout England, including some new hospital sites that are coming on board. And very excitingly, which I don't think you even know yet, is that we now have all our approvals in place to open in Cork in the Republic of Ireland.
Yeah.
And we're having conversations this afternoon to get that up and running. So we're hoping that by the summertime, patients within Ireland will also be able to take part in the study.
Absolutely brilliant. So you've got Belfast and Cork, and I believe Limerick is due to come online, isn't it?
So we have Limerick and Dublin, our tentative sites. We don't have funding to bring those on board yet, because obviously it takes quite a bit of money to recruit patients, and our blood samples cost quite a lot to take. So we are looking at additional funding mechanisms whereby those sites could be brought on board, so that we have a wider demographic of patients taking part.
That is brilliant. And can I ask you, Lesley, what is the long-term aim? How do you see the end game here with all the study?
So I'm hoping from this study that we will be able to identify factors that are linked to the development of MPNs. There's a number of advantages of being able to do that. One is looking at being able to prevent people from getting MPNs in the future. So if we identify potential exposures, for example, exposures that people may have had from their job or from their lifestyle, we can communicate that with the public and hopefully try to bring in mechanisms to reduce people's risk of developing MPNs. But what we can also do from identifying the causes is have a better understanding of how the disease develops itself, understanding about what might happen to patients with MPNs and their long-term outcomes, and also then help to identify perhaps new treatments that might be able to help patients with MPNs.
Do you know, this is the most exciting thing, really, really exciting. And I know a lot of my fellow patients will really resonate with the excitement of hearing that. So how long is all this going to take?
So we have the study up and running at the moment. Unfortunately, we were delayed significantly due to COVID because hospitals shut down for research studies, and it was difficult to get staff available to recruit patients into the study. As I say, we're now open in 14 sites across the UK. We're opening in further sites over the next few months. I suspect that we will have our numbers of patients recruited by this time next year, and that we will have our first sets of results coming out by September 2024.
What a date to look forward to.
So yes, absolutely. I'm very excited as well.
Good, good. Well, thank you so much for giving that update, because I know a lot of people will be interested. You know, there are so many people who specifically fundraise for MOSAICC because,
Yes.
you know, particularly patients. And it's one of several of our research projects that we help to fund. But this has been really informative, actually, really, really useful. And thank you again. And I look forward to hearing you and meeting you when we do the forum in Inverness on the 6th of September.
Sounds great. Really looking forward to it. And I would just like to encourage patients and also friends and family members of patients who are invited to take part in the MOSAICC study to take part. We are here and available, and I'm sure we can get the email address of the study available to patients. We are really keen to try and recruit patients over the next few months. So please wait until you're invited to take part, because there are criteria that patients need to meet in order to take part in the study.
So how do they go about this?
So patients have to be diagnosed within the previous 24 months. They have to have a confirmed diagnosis of a myeloproliferative neoplasm that needs to be confirmed by their healthcare practitioner, so their doctor. And the doctor, if they are eligible, will contact them and ask them to take part in the study if the site is open. But please ask your doctor if you are going to clinic and are interested in taking part, to see if you might be eligible as well.
And you mentioned friends and family. How does that
yes.
system work?
So as I said, we need people from the general population to also take part in the study to be able to compare exposures. What we have asked is for anybody who is invited to take part in the study as an MPN patient, they're also given a small A5 envelope to provide to a friend or non-blood relative member of their family, and they can provide that envelope and don't have to take part, but we really would encourage any friends or family members that are invited to participate.
So the information can be found where?
So the information will be provided as part of the invitation pack that's given to patients at clinic.
Brilliant. Thank you. And it's just been so exciting hearing how MOSAICC's progressed from the early days of the pilot study. And you know, look forward to September 24.
Absolutely, and our thanks go to MPN Voice and the other charities that are also supporting the MOSAICC study. Without that financial support, it wouldn't be possible. So thank you very much.